Hi everyone, welcome to another episode of Humans for Care, Stories from Healthcare Leaders. This is our series where we talk with healthcare leaders about how AI is being applied in practice to enhance care and operational efficiency. Our guest today brings deep hands-on experience in patient experience and hospital operations across some of Philippines' largest healthcare institutions. She's currently the AVP of Patient Experience at Makati Life Medical Center, where she leads initiatives on improving patient journeys, service qualities, and operational excellence. With more than 20 years of experience shaping how hospitals engage, communicate with, and care for patients, she brings a uniquely grounded experience and perspective on what truly works in patient experience. We're excited to welcome Ms. Hani Alejo from Makati Life Medical Center to talk broadly about AI in healthcare. Ms. Hani, welcome.
Hi, Wei. Thank you for inviting me. I am beyond thrilled to be part of this very innovative and collaborative partnership with you and to the rest of the healthcare leaders.
Absolutely. Ms. Hani, I'm going to pick your brain a little bit on the first question around where do you see AI adding the most tangible value in hospitals like Makati Life, where patients' volume are generally very high and operations are generally more complex as well?
Yes. In a hospital like Makati Life Medical Center, where patients' volume, just like what you said, are high and workflows are layered across multiple departments, AI adds the most tangible value in areas where repetition and coordination create friction. The greatest impact is seen on appointment management or settings, automated reminders, eligibility checks about insurance. Just like us in Makati Life, we're also catering to the or we subsidize the Makati citizen healthcare benefits are being subsidized by the city governments, and also the follow-ups and structured communication. So these are tasks that consumes enormous administrative bandwidth, no, but do not require complex human judgment. When AI absorbs all of these functions, it immediately improves operational efficiency while also reducing patient anxiety. You know that it is very important to me, the patient experience, because patients appreciate timely reminders, clear instructions, and consistent updates. And these seemingly small improvements significantly elevate the overall patient experience. And hospital leaders, however much approach AI with the right mindset. No? AI should not be introduced as technology upgrade. It should be framed as a patient experience enabler.
Wow, I like how you frame that as AI as a patient enabler, right? And I know that in Makati Life, you have introduced several AI tools over the last couple of years, right? I just want to hear from your experience, when you are deploying such a solution on the ground, what kind of operational or patient engagement gaps are often underestimated by technology teams?
AI should not be treated as a technology upgrade, but it should be an enabler. The starting point must always be on the patient journey. Where are the bottlenecks, the pain points, and where are the staff being overwhelmed? No, when leaders align AI deployment with both operationals, the key performance indicators, and patient satisfaction goals, adoptions become smoother and outcomes become measurable. If AI is positioned purely as a cost-saving tool, it risks resistance. If positioned as tool that allows staff to focus more on care and less on repetitive tasks, it gains cultural acceptance. And I think
Absolutely.
one of the operational gap that technology or the healthcare practitioners often underestimate is the fragmentation. Patients do not experience hospitals as one department, no, or in one department. They experience them as a single journey, yet internally communication is often siloed. So I think the rest of the healthcare leaders would agree to me that even if we have a very good technology or AI, communication is more often being taken for granted.
I'm glad you mentioned about patient being a key part of this engagement exercise, right? Based on your experience, how have patient communication evolved since AI was introduced? Were there any patients that responded differently? Were there any unexpected improvement or challenges that you face when you're deploying a chat solution to your hospital today?
When we implemented or integrated AI technology with our current hospital setup, of course, we had to, the first thing that we considered is the type of patients that we are catering to. No? It is very important for our patients to understand the kind of tool that we are offering. Most of our patients are elderlies, and so we have to consider them as well. But we also have like the segment of the young professionals and tech savvy, and that's why in every implementation or integration with AI, we have to make sure that we are guided or our patients are guided with humans. So we have my team and the rest of the business units who who guide our patients throughout the journey, especially on using AI technology.
Thanks, Miss Honey. I think that is super interesting. I just want to get a perspective from your end also as well. When you were deploying AI solution, what are some of the key metrics or really results that you're looking at when you deploy a chat bot solution to your hospital today?
From our experience, AI has positively influenced operations, staff workflows, and patient experience at Makati Life Medical Center. Operationally, it has reduced manual workload related to frequently asked questions and general inquiries about the Makati Life. No, and our agents are now focused on some more meaningful or impactful patient engagement, like escalated cases, and we're actually on the work of the phase two, which is the scheduling our agents on the repetitive tasks that they're doing right now, especially on the management of the schedules. Definitely, the key performance indicators that are being addressed by the AI bot is the responsiveness of the hospital and the timeliness, especially on the inquiries that we're receiving through our contact center. AI's role in hospital workflow should be clear. It is a stabilizer and a scale enabler. It ensures that routine processes happen consistently and accurately, even during peak volumes. But it should never replace human empathy. As patient experience professional, complex conversations, emotional reassurance, and clinical decision making must remain human-led. So AI handles structure, and our people deliver compassion. So I think AI should not replace the human intervention. I think they complement each other to offer a more seamless patient experience.
I absolutely agree with you. I think the empathy in AI, in an AI dominated world, empathy becomes more important, right? And really, Miss Honey, looking back, right, what aspects of your AI implementation from rollout to everyday use do you think really made it successful? And what lessons would you like to highlight for other leaders who are watching this as well, who are considering similar initiatives? What should they be really looking out for when implementing an AI solution?
When we thought of integrating with AI technology, we started with the pain points. So we started with the patient journey of the current patients that we're catering here at Makati Life Medical Center. And from there we identified pain points. And from those pain points, we establish small wins or quick wins and the long-term goals that we would like to implement to address these pain points. And one of those is to integrate or acquire an AI technology that will enable us to do more valuable tasks and give the repetitive task to the AI or to the bot. And very important in on the integration is the communication. The communication within the business units or the stakeholders, and of course, the communication to our customers or patients. And we did not treat the AI solutions or the technology as an additional cost, and we did not think of the AI technology to replace our people, but it's more of complementing our people and working in synergy. So we can offer a seamless patient experience. For hospitals considering similar initiatives, just like Makati Life Medical Center, the lesson is simple. Start with operational pain points. Protect the human element, measure both efficiency and experience metrics, and scale intentionally. When AI is aligned with patient experience strategy, it becomes more than a tool. It becomes an engine that supports sustainable growth without sacrificing care quality.
Thank you so much, Ms. Hani, for sharing this insight and experience with us today. It's clear that AI can support hospital operations in ways that really complement human care, improving efficiency, but really maintaining that patient focus, that empathy that you mentioned earlier on as well. For our viewers, we hope that this conversation gives practical lessons, inspiration for how AI can be thoughtfully applied in hospital settings today. You can find more episodes of Humans for Care on our YouTube channel and LinkedIn page, where we continue to speak to healthcare leaders about AI in practice. Join us in the discussion by using the hashtag Humans for Care. And until next time, we'll see you again.